Hi everyone, welcome to our Ask the Doctor series where Dr. Pizzella and I answer patient questions that was submitted online. Today's question is, what is surgical mesh and how does it help with urinary incontinence? So the type of urinary incontinence that mesh can help with is stress incontinence. That's that frustrating leakage when we cough, laugh, and sneeze and jump around with our kids, that we leak during those movements. And the reason that happens is really about a weakness at the bladder neck or urethra, that when we push down on that bladder, the urethra moves and allows urine into that channel. So what the surgical mesh does is it becomes a hammock for the urethra, so that when you do that cough, laugh, and sneeze movement, the urethra has a backboard to sit on. Now this surgical mesh is very different from what women have heard of as far as the mesh that was taken off the market. A lot of women have that concern when they come and see me. This mesh is anchored into the muscles around the urethra. It's a single incision mesh, a 30-45 minute procedure, and you're home the same day. The surgical mesh that was taken off the market is this mesh. That mesh was for pelvic organ prolapse, and it was sheets of mesh with arms of mesh that went into muscular compartments. The mesh is not inherently bad, it's how the mesh was used that caused unintended consequences. And that's why that mesh is no longer available. But this mesh is still the gold standard of care, and it is the most well-studied procedure for urinary incontinence, and trusted from organizations across America and internationally. If you need a reference for that, I can link you up with the Joint Commission statement from the American Urogynecology Association about the safety of mid-urethral slings for stress urinary incontinence. If you have any other questions that I can clear up for you, come on in and speak with me.